One of the things I have been worried about that's been missing in all of this is a skeptical approach to the data by media and by opposition. At the moment, of course, one of my concerns is government and opposition happen to be in agreement on these particular measures. So it falls upon me to give you some analysis on the data. Now, how we make decisions should ordinarily in normal times be appraised by an assessment of how we made them in the past on the same given issue, and how we interpreted the data in the past, and how that data fares in hindsight, looking at it now. So let me give you some of my concerns, which are about the data and how they've been interpreted. What I'm looking at is an article called The 10 Worst COVID Data Failures on the 25th of October 2020. It was published in the Spectator, written by one, of course, Professor Heneghan, a very well-established and eminent scientist, perhaps the leading statistician in the country. Now, what he's done is he's gone through the data and he's raised concerns about where there have been data failings, and there are 10 of them, and I'm going to go through them for you. One, overstating the number of people who are going to die. This began with the now infamous Imperial College Report 9, modelling 50,000 deaths and 250,000 deaths if restrictions were not tightened. Now, that really didn't happen. And some say, well, it didn't happen because lockdown worked. And Professor Heneghan says, well, that doesn't really explain the anomaly of Sweden, where those same models said there would have been 85,000 deaths if Sweden didn't lock down. Well, that didn't happen. There were only 6,000, of course, 6,000 too many, but it's a great deal less than 85,000. So the first point there, mentioned by Professor Heneghan, is the unreliability of the modelling and the lack, in hindsight, of going back to what was told to us then and saying, well, you got it wrong then, how do you know you got it right now? The second big concern is around leaked SAGE papers, because SAGE had said that we needed a 2-week circuit breaker, and the leaked report was alarming. It said that it could potentially spiral out of control if we didn't, and kill 217,000 people, hospitalise 316,000, and infect 20.7 million. But they said that with the strict 2-week circuit breaker lockdown, that could be reduced by 100,000 admissions. Now, that, of course, made headlines, but when the lead author was interviewed by the BBC, the lead author of that very SAGE report, he said, quote, he wished he hadn't put these numbers in the study because it was an extreme scenario only included for illustration. Concerning. The third concern is what was known as the miscategorization of COVID death. Under the original system, did you know that someone run over by a bus would be counted as a COVID death, even if he or she had tested positive for COVID later, but recovered? I mean, quite literally died by being run over by a bus, but at one point in their life had COVID and recovered. In the early days, that would have gone down as a COVID death. When this anomaly was pointed out by the Oxford Centre for Evidence-Based Medicine, it turned out that even the Health Secretary was unaware of it and ordered an immediate inquiry. But that does raise concerns about how we are recording deaths. A new system was eventually set up, counting deaths within 28 days of a positive test, and that removed 4,149 deaths from the 15th of July death count. Another concern is overstating the effect or success of lockdown on reducing virus transmissions. So Patrick Vallance on the 17th of March, he said that keeping coronavirus death toll in the UK to less than 20,000 would be a good outcome. And yet after a lockdown, a range of 7,000 to 20,000 deaths was given by Professor Neil Ferguson, but COVID deaths are now approaching 45,000. So by both of their estimates, what they said lockdown would do, it didn't do, and deaths kept going up. And actually, when they said it would be, if we locked down, we'd only have 7,000 to 20,000 deaths, we did lock down, and we still got 45,000. And so what they were saying was going to happen and would work, didn't work. Are we looking back to assess any of this? 5, exaggerating COVID's impact on hospitals. Well, a leaked report written in April, a leaked NHS report, warned that the UK would need 25,000 hospital beds to treat COVID patients. However, on the 24th of July, the daily count confirmed patients in hospital was 928 in England, 1,356 across the UK. In other words, only 5% of the predicted hospital beds were taken up. Another concern is exaggerating the fears about lifting the lockdown. And so at the end of the day, on 29th of May, SAGE advisors said that COVID-19 was spreading too fast to lift the lockdown in England. But in June, it was around 20% over the norm for the month for the UK, but cases continued to decline. Another concern, of course, number 7, is that infamous Patrick Vallance graph that was shown on TV. The Vallance chart showed infections hitting 50,000 cases a day by the 13th of October without any action. It did not lead to any change in policy, but when that day arrived, the moving average was only, and I say again, only advisedly, 228, not 50,000. There's the Excel spreadsheet blunder, which we're all aware of, which again raises concerns about how this data is being kept and handled. This is a really important one, number 9, a reluctance to acknowledge uncertainties in evidence. Let's take, for example, a 2-meter rule. So Patrick Vallance told the Health and Social Care Committee on the 5th of May that a minute at 2 meters contact is about the same risk as 6 seconds if you're 1 meter apart. In other words, he's saying 2 meters works better than 1 meter, right? But on the 4th of June, SAGE gave a very different estimate. They said at 1 meter it could be 2 to 10 times higher than at 2 meters. And so we've got to understand that when positions are being chopped and changed, when your new position is being reported, do not report it as if it's the only thing in town, it's the best thing since sliced bread, and there's no other opinion, and that all other opinions are fringe. No, there are other opinions, and even your opinions have been wrong by your own data in your own words. Number 10, lack of access and transparency in data. The Manchester Evening News had asked trust by trust for COVID admission numbers as a proportion of overall capacity in Greater Manchester. 6 out of 7 relevant trusts did not comply with the request. Now, poor quality data in all of this leaves us unable to say whether, who died because of COVID, who dies with COVID as a cofactor, who dies after contracting COVID of another infection inside hospital. Deaths outside hospitals are not subject to detailed analysis, despite their importance, and the use of the word cases implies that all cases are the same, when actually they are not. And so, if the government's approach is to always and only publish worst-case scenarios, is there any wonder that everybody is feeling scared? What I'd like is not anyone to disobey the new regulations. Of course, everyone, please follow the law. That's what we are, what makes us citizens in this country. We're the social contract in a democracy. We elect our government and follow the law. But you do not subject your thoughts to a democratic mandate. Your thoughts are yours. You have every right to question and be skeptical, especially when your civil liberties are at stake, and especially when a conversation is as critical and as important as this. And really, I think that's it. That's my main point here, which is, are we being skeptical enough about what we're being told? Are you worried about how long this lockdown will last? And do you understand the rules? You're listening to Maajid Nawaz here on LBC. The time is 1:18.